it becomes clear now from what we have done that some of you might be a bit scared, like, yo, how are we going to do this in Python? But I tell you one thing, doing simulations in Python, in MATLAB, in Mathematica, those are simple things that we are also going to train you guys on this platform. So you need not to be scared. And the code is the same anyway. You can see that all you need to do is to change the differential equations. Maybe you are not interested in really understanding what is going on behind Python. You just want the code. Then the code is straightforward. One of the things that I will do is maybe I'll also upload the source code for the code that I have been using there. I'll actually upload it for you guys. But then we need to emphasize, according to Howard here, he's saying, look, we are supposed to stress that the existence of a threshold for infection is far from obvious. And sometimes most people, many public health and infectious disease experts, they miss that a lot. A case in point is one in South Africa, whereby then there was a declaration that people must actually dig up 1 million graves for COVID 19. So they dug up 1 million graves in preparation of people's deaths. But then we never had so many cases. We didn't get so many infections up to that point. So most public health and infectious disease experts, they actually miss the threshold for infection. It's far from obvious. And the reason is that such a threshold cannot be discerned from data. Data cannot tell us what is going on. Actually, it requires a mathematical model to illuminate. And also, the handling of the mathematical model is something else different. So, I want you to get this straight. I want you to understand that after the simulations that we are doing here, following Howard's work, we are going to look for data maybe on COVID 19 and then simulate again. But in this particular case, we'll be dealing with a bigger model and also trying to just bring everything in from the health perspective so that at least we can say, if we are advising people, what are we going to advise them? We want to act as if we are going to give the output of our work to some health officials, some government officials on health so that they can actually use it. So we are going to realize that there is more to this work than what we have done just now. Now we're just showing each other the basics. And we are going to look now into the public health interpretation of the RE, the effective reproductive number, and its implications. That's what we are going to be doing next.